Okay, I wanted to talk a little bit about our kyphosis and scoliosis post-op protocol for the time period between 3 and 6 months. 3 and 6 months we're doing a lot more activities, and you're getting back into most activities, less restrictions, things like that. But I wanted to go over a few specific things that we have on this protocol. So first on here is participate in low impact and body weight training, but no running or jumping. During this period we don't want impact into the spine. The spine is still healing, the bone is still remodeling, we're still getting stability. So we don't want to jar that and cause impact. So that's a big one, no running or jumping during this period. We're doing gradual conditioning and training for sports at 4 months. So not at 3 months, at 4 months we're starting to do that, but we're not doing competition or contact sports. Your surgeon may have a little bit of a different protocol based on when you can return to sport or when you can run. This protocol was developed with about 6 surgeons at the same time, so some of them have different ideas on that. So check with your surgeon specifically at your post-op appointment. Then we have progressive resistance training specific to sport and recreational activities. So doing exercises that will help you get back to your activity. That I'm not going to demonstrate those because there are too many of those to really talk about. But doing things that are specific to what you want to get back to, that's the key. And gradually, progressive meaning we're not starting out at what you could do before surgery. We're gradually progressing back to that. Cardiovascular conditioning, that's important because your lungs and your heart need to work harder to keep up with your activities. So doing things like, and in here it talks about stationary bike and elliptical as well, 30 minutes several days a week. Great way to get cardiovascular endurance. So we're not just working on strengthening, we're working on general activity as well. So make sure you're getting activity and getting your heart rate up. And sometimes that's hard to do without running, but you can do the elliptical and you can do the stationary bike and things like that. And swimming, actually swimming is part of this one too. Swimming is a great way to get cardiovascular endurance. So not a bad time to get back to activity during 3 to 6 months on this protocol. If you're having pain or sometimes this is when pain starts to creep up, and if it's not going away or it's not reducing, this is a good time to address it. So if you're having that, please give us a call. We can help you to not have that pain continue. And in the description on this webpage, make sure you're looking at the signs of infection and things like that, because during all of these phases, we want to make sure that we're not having infections. So thanks for watching. Hopefully that was helpful.